that, I'd like to introduce someone we're very happy who's joined us, a good friend of PdF, and someone who's working on these issues every single day in our nation's capital, the CTO of the White House, Mr. Aneesh Chopra. Please welcome him.
Well, thank you very much for those opening remarks and for your kind invitation for me to join you today. It has been an exciting journey from the President's very first full day in office when he issued his memorandum calling for a more open and transparent government. Today, it is my pleasure to share with you a briefing on where we are on this long-term goal to change the culture of Washington and to hopefully seed new opportunities for entrepreneurial activity at the grassroots level, the spirit and the hallmark of a conference like PdF. So allow me to share with you a few background comments to start. My colleague at the State Department, a good friend, Katie Stanton, who joined the administration from Google, had this to say about the culture gap between what we experience as consumers and what we experience in our government. We live in our personal lives, I'm sitting next to Esther Dyson with her iPad, where there's an app for that. But for many of us still in Washington, the reality is such that we have a form for that. And you can see pictured an actual file cave, that's what we call it, a file cave, in the mountains of Pennsylvania, where we still actively store federal personnel records. And in fact, buildings like this around the country have been visited by fire marshals to say they're overweight, their constructions are at risk because of the sheer magnitude of information and files that have been accumulating over the years. You can see quotations from the President's memorandum on open government at the bottom of the page, where he committed to an unprecedented level of openness in our government. To do this, last year at this very forum, my colleague, our Chief Information Officer, Vivek Kundra, debuted the first of our initiatives to instill greater trust in the government in which we all participate. And that was to give you more transparency on the information about how we are spending your dollars. I share with you the one-year update on that announcement to highlight just the kind of culture change this is having in Washington. I'll just demonstrate one agency's example. General Shinseki, who runs a Department of Veterans Affairs, in collaboration with his world-class Chief Information Officer, Roger Baker, established a very aggressive management system, halting and reviewing every one of their 282 IT projects worth roughly $800 million. This review process has led to a stoppage or a slowing down of 2/3 of all of the IT projects under review, freeing up $300 million in fiscal 2010 resources to push on higher priority items that have achieved a better performance for the taxpayer, including the President's key priority of reducing the disability benefits backlog. Today, a veteran has to wait, on average, 160 days to hear whether or not he or she can get a hearing aid, for example. We're also taking advantage of these tools to improve customer service. Last year, early, I was confirmed on May 22nd and on June 25th, so within a month arriving, the President said, I'd like you to join hands with our Chief Information Officer and then the Chief Performance Officer to collaborate with the Citizenship and Immigration Services to, with no new money in the budget and no new laws to work with, make significant improvements on the customer service front. Because for my family, my father's in the audience, and other immigrants, customer service and the Citizenship and Immigration Service don't often be perceived in the same context. Well, what we had done at that time was something very simple, changing the default setting to allow us to push to you information about the status of your application, rather than waiting for you to hire your lawyers and your processes to come in, knocking on doors to find out if we've made any movement on your application. Since the launch of this program in September of 2009, over 140,000 applicants have enrolled. We've sent over 124,000 text messages and over 1 million emails. What was really surprising was just a month ago, when a survey firm conducted research on customer satisfaction with government, the citizenship and immigration system ranked 4th of all government sites for customer service. Again, by taking simple tools that we use in our everyday lives and pushing them out into our agencies at virtually no marginal cost, but simply a culture change in how we think about connecting with the American people, we are starting to instill a culture in Washington that truly understands the President's vision for a more open and transparent policy environment. I'm also pleased to share with you what's to come. Today, I'm very honored and pleased to share with you the latest installment in our simple ideas that don't cost taxpayers any money. Today, we announce a commitment to produce what we're calling the Blue Button to liberate personal health data, a tool that is so simple in its idea you wonder why we hadn't done it before. For veterans, Medicare recipients, and others who have health data available to them today on government websites, we will be debuting this fall a simple button that would allow you to extract from the government databases your information and frankly do with it what you want. Invite other entrepreneurs to consume your data in a manner that provides greater value for you. Simply store it for yourself so that when you go into your next physician's appointment, you can bring a copy with you. Your choice. It's your data. Both Medicare and the Veterans Administration are committing to have Blue Button operational by this fall, and I'm very pleased that more will come. Again, a simple proposition. It's also about the policy environment that we've engaged, so that this is not just one-off activities on agencies like the Citizenship Program or the work we're doing with Blue Button. It's about instilling a policy environment that says this is the default position for how our agency should operate. This is the story of the Department of Agriculture stepping up to the plate days after the Office of Management and Budget had issued new guidance to agencies on the uses of prizes, challenges, and competitions as a way to engage the American people in their government. Not everything has to be done by RFP or other tools we traditionally rely upon in Washington. So the First Lady said to the Department of Agriculture, "It is important for me in my efforts to promote healthy nutrition," and her campaign that we call the Let's Move campaign. As one of her most important pillars of that campaign, it's to inform the American people about their healthy nutrition choices. Well, we have a database in the Department of Agriculture that has data on 30,000 food items. 30,000 food items. We have made this information available to the American people, and we've built a campaign around it. Here, I'm pleased to report, we've had thousands upon thousands of participants. I participated in a game jam that happened about 2 weeks ago, where we had students from around the country convene at university campuses to literally see what they could do to form teams and build new games. The teams that I had visited with just a couple weeks back had produced 20-some-odd games over a weekend. We have a world-class team of judges. I was pleased to announce that the CEO of Zynga, Mark Pincus, who has been the proud father of Farmville, a game many of you may be aware of on Facebook and other platforms, is one of our judges to help us distribute very modest resources. We're putting roughly $60,000 in prize funds available to celebrate the entrepreneurial spirit of the American people, all with the very simple goal of helping people understand the nutritional value of the foods they eat. These policy environments also have led to a very interesting observation. And that interesting observation has been something the President called for in his memo on that first full day. A notion that in our society, knowledge is widely dispersed. And if knowledge is widely dispersed, how do we capture the insights from the American people? In traditional environments, it's difficult. But with the use of today's technologies, the crowdsourcing platforms, and others, we can find that needle in the haystack and bring those ideas to fruition. I share with you the results just for the first time today released. NASA's early experience with the Innocentive Scientific Expert Network platform, a platform of roughly 200,000 scientists, where NASA said earlier this year, we're going to pose a few difficult scientific challenges, one of which was how do we forecast solar activity so we can better predict when and how we should release our rockets into space. This particular vexing scientific challenge was one that had been grappling the scientists in NASA and its contractors for quite some time. Well, by putting out this challenge in this Innocentive platform, wouldn't you know it, as expected, a semi-retired radio frequency engineer living in rural New Hampshire, a town called Leominster, literally with just an internet connection, was able to share his idea on how to address this problem. It had so blown away the others whose ideas were under consideration, NASA reported that this had exceeded their requirements. No complicated RFP, the need for a lobbyist, some convoluted process, just a smart person in our country who could help solve a difficult scientific challenge and was paid a modest $30,000 for that insight. We are involving ourselves in these programs as these policies come to fruition. But I thought for today, more than anything else, it would be helpful if I could provide for you a summary or an anatomy of just how we're trying to put all of this together to form an ecosystem that changes the relationship between the American people and our government. Today, I'd like to highlight for you in this anatomy the Health and Human Services program, the Community Health Data Initiative, launched literally 2 days ago by Secretary Sebelius herself. We convened at the Institute of Medicine and had one of those very inspiring moments where literally 20+ innovations, new applications and services debuted for the American people at no cost to the taxpayer, but with one simple proposition. They were all built on information that had previously been locked up within the Department of Health and Human Services and now has been liberated in a commitment to publish a whole range of information on the performance of communities to how we address obesity rates and other benchmark indicators and the like. The Community Health Data Initiative, as background, was one of the commitments the department had made in response to the president's call for a more open and transparent government. Now, to rewind for a moment to give the context. Following the president's order on day one, he'd asked for a set of policy recommendations from my office, which were promulgated with the help of the American people through the Open Government Initiative, which translated into a formal policy document issued by the director of the Office of Management and Budget, the good Dr. Peter Orszag, who had shared with the agencies a very clear set of expectations for what it would mean to instill these values in their agency. Key to that memorandum, that policy guidance document, was that every federal agency would have to form a compact with you, the American people. Visit any agency /gov, so hhs.gov/open, or the Veterans Administration, va.gov/open, or defense.gov/open. Every agency, in their own words, has communicated how they will instill those key values in their relationship with you. So in that context, HHS had said, one of the key principles we'd like to address is how we bring transparency to life, how we form an ecosystem of activity with a simple goal. The Department of Health and Human Services mission statement, to improve the nation's health performance. Now, some of that is in a policy context. You may have noticed we had a bit of a debate this year on health care. And that was a policy debate about the rules of the road so that we have a fair system for all. But it also means how we ensure that if in Topeka, Kansas, or in Arlington, Virginia, we can find ways to ensure that we actually improve our health. You know, in this country, we have a challenge on areas like infant mortality rate and others, where we are lagging on global indicators. Now, I'll share with you one example of what emerged on Wednesday's session. It wasn't just entrepreneurs, it was corporations big and small who participated. And just as an example, I was excited, Microsoft on their Bing search engine decided to incorporate quality and patient satisfaction data that had been available on hospitalcompare.gov. By a show of hands, had any of you visited hospitalcompare.gov? Right, I can hear crickets are chirping, a couple of you, right. But now, when you visit, if you were to type in New York Presbyterian Hospital, where my sister actually works, in Microsoft's search engine, Bing, called up right near the top, in a very specific and prominent location, is the data that came out of the Health and Human Services benchmarking system. So you now know that, in this example, patient satisfaction is pretty strong at New York Presbyterian Hospital. It exceeds the statewide average, and you can learn more information. And you could actually find data on nearby facilities as well. It wasn't just existing tools that were incorporating data. They actually were celebrating new and entrepreneurial ventures. I was so excited to learn about Asmapolis. We all had a hard time pronouncing this. An entrepreneur who lives in rural Wisconsin, who lacks broadband access, has to drive some 45 miles just to get to an office where they have sufficient connectivity. This young man said, I have a simple proposition. How might we democratize asthma reporting? One of the challenges we have in the public health community is that we have a rear view mirror look on issues like where are we seeing a spike in asthma attacks. And as many of you know, asthma is one of those conditions that is very costly and damaging to our nation's health performance. This speaks to the notion of the increase in data sensors that we're finding all around us, because he had a very simple idea. Let's add a very thin layer, a physical layer, on top of your asthma pump. If you choose to voluntarily participate, when you in fact pump your asthma inhaler, it will record through GPS your location and the time in which you conduct this pump. And as more and more of our life is connected in new and creative ways, that information can be visualized. And you can start to see patterns that emerge about where there might be some areas of concern in terms of air quality that you might want to stay in or be more mindful if you are at risk for an asthma attack. This information he decided to make freely available as part of this ecosystem of improving health performance. And it's also about building layer upon layer of value. Google's contribution to this particular endeavor was interesting. They simply extracted, frankly, flat files from the government. We have flat files. These are CSV files and other files. And uploaded them into their Fusion tables, which is one of their beta products, that includes an API. Now, anybody can build applications, geolocation-coded applications on the exact same data that I had said heretofore had been in Washington, either on the Hospital Compare website or by our efforts, you could download the flat file, but now is released in a situation where literally in minutes, one could take advantage of these assets and create completely new applications we haven't even envisioned. The physician lead for Google on his own time, his 20% time, quickly put together a very simple construct. Where in America should you go if you have chest pain? And so he said, for example, here in New York, Beth Israel Medical Center, he provides benchmark data that we have in our systems on whether the hospital itself, in his words, are heart-friendly. That is, here are the indicators of quality performance. How well does the hospital provide angioplasty within 90 minutes, which is considered a best practice? How well does the hospital provide you aspirin upon arrival in the emergency room? Again, a best practice. And how that particular hospital benchmarks. And also captures what he calls people-friendly data, the patient satisfaction information. The one I thought was particularly interesting was quiet at night. Apparently, we survey how easy is it for one to sleep. It turns out the average in New York City is only 1 out of every 2 people have reported to be relatively quiet at night when they sleep. And the point is that this ecosystem, it starts with a very simple proposition that we as a government have access to the information that if we simply released and convened, others can communicate and collaborate to build more value over time. So in this example, again, the Google tool is interesting, but the APIs would allow you to do something even more interesting. And I hope in days and weeks to come, more will happen in this regard, which is why we announced on Wednesday the latest endeavor in this movement, a movement to call for more creativity and entrepreneurial energy in our health space by launching the Health 2.0 Developer Challenge. Anybody is allowed to participate. This Monday, over 800 entrepreneurs are convening in Washington, D.C. as part of the Health 2.0 conference, who has come together to say, by this fall, when we reconvene in this entrepreneurial community at the Health 2.0 conference in Silicon Valley or in San Francisco by October, how many more activities, applications, other platforms might we see emerge that will help the American people improve their health? Again, all built on a very simple proposition. No new taxpayer money, no new change in law, just taking advantage of these tools and capabilities to inspire and tap into that entrepreneurial energy in the American people and improve our overall health performance. I see Ellen's in the audience, and I want to thank her for her contribution as a partner in this endeavor that will just kick off. More will come. I'll end, as Andrew had asked if I could end to allow for some time for questions. I'll end with this final observation about the spirit here. I want to put this story all together by resharing the story of the DARPA initiative called the Network Challenge, to share with you how all of these programs are coming together. By a show of hands, how many of you were familiar with the Red Balloon Challenge, the Network Challenge that DARPA made? Most of you. What was inspiring about the challenge was this. The winning team from MIT had used a very creative incentive scheme to build out its network in order to find these 10 balloons. And the lead postdoc who helped to design this scheme said, I'm empowered. I want to use this same scheme to inspire the world to go after a problem that I care about, and that is addressing the issue of hunger. In collaboration with the UN, the winning postdoc on the MIT team has launched, in this new commitment to e-democracy, the program around hunger, and challenge us to go after, in a simple concept, petition your government to go after those billion people around the world who live in chronic hunger. And it's that same spirit of rewarding those who invite people to a network, who invite people to invite people, invite people, who build out that ecosystem of supporters. And while I showed this slide earlier at 56,000 supporters, it's now well in excess of 100,000. His principles are carrying forward. It is this spirit, and by the way, the end of this story is that the team, the same logic of this effort, is now being used to start a new business in Africa that is connecting people through mobile platforms to do simple tasks that can be done in a distributed fashion. So you have a DARPA research endeavor translating into e-democracy, translating into economic opportunities by taking advantage of these new and emerging platforms. Thank you for hearing me out this morning. I look forward to your questions and comments.
Stay here. Thank you. Perfect.
Right,
so, for those of you who may like to ask Aneesh a question, if you could come down to either of the two microphones at the bottom of the stairs here, and we'll get to as many as we can. Aneesh, one clarification, actually. I said that Aneesh is the CTO of the White House. He's actually the CTO of the United States.
Oh, whatever. Yeah, he's a killer.
So, Aneesh, it's great to see you so enthusiastic and so excited. We heard an interesting statistic yesterday, which was that there's 2,600 political appointees in the Obama administration.
That sounds right.
How many total government employees are there?
Oh, it's in the millions.
Okay, so...
And if you add contractors to the mix,
okay, so assuming that every single one of those 2,600 political appointees had the same sort of DNA you have about what this technology could do and how the way we think about information in these new platforms, how do we actually convert that entire bureaucracy of so many people who are built into systems that have been for decades stuck in a 20th century mindset into one that is, points to the one that you're just pointing to, not just even acting on it, just pointing to the one that you're talking about?
Briefly, I'll say this in 3 parts. One, we had to set the policy framework right, which is why we've been issuing a lot of these memorandums so we get the culture. There's a lot of concern, for example, of procurement. I joked on Wednesday, could you imagine those 20-plus applications being built by government RFP? It would be a disaster. So the fact that we opened up the policy environment for that collaboration was one. 2, I'd say a good portion of my job is, frankly, HR. It's seeding entrepreneurial talent across the federal agencies that have similar goals. The entire health anatomy I described is because of the work of Todd Park, who had been the founder of Athena Health, one of the most successful healthcare IT companies, who chose to come into Washington at great personal expense to be a part of this movement, and many more like him. And third, and this is perhaps the most interesting thing, Andrew, this is not one where folks are not interested in helping. If you work in a federal agency and you feel like you can make a difference in the country, you traditionally had two choices. Wait for legislation where your ideas could become law. That takes every 5 years maybe. Or beg for resources in the budget so it becomes a priority. But both of those policy levers are very complicated and take a long time. But releasing data and spurring performance improvement, you can measure results in 90 days. Every one of those 20 applications started because on March 11th at the Institute of Medicine, we had 25 public health government employees mashed up with 25 kind of Web 2.0 folks. And one day, they convened, mapped out needs, and these guys produced the 20-plus applications. 90 days later, with no taxpayer cost, the public health professionals are ecstatic, saying, gosh, this is exactly what we need. So, Andrew, I think this is not a sales argument to get the agencies to buy in. They need to know how, given that they've got a policy framework and we're pushing.
So one more question from me, and then we'll move it to the audience. But last year at PdF, a company announced itself here called Challenge Post.
Yes, sir.
And a year later, they just announced that they are the platform, the federal government platform for challenges. So maybe you could explain a little bit what that means.
So as part of our commitment to the prizes policy and challenges, we invited platforms who are willing at no charge to the taxpayer to enable a lot of these capabilities. You saw the graphic I had on the Apps for Healthy Kids, which described the First Lady's Challenge. That was built on a Challenge Post platform. I'm pleased to note that the General Services Administration, after convening a competitive process, selected Challenge Post to be the platform for helping agencies make this a reality. And it's just part of our commitment to make tools available so that the agencies don't have much difficulty in actually onboarding themselves into this new paradigm.
Terrific.
Yes,
please just
sir.
identify yourself in as short as you can.
Yeah, Evan Hutchison from the Kennedy School. Graduated, so I don't have anything else to say right now about my career. But anyway, I had a question. So you talk a lot about entrepreneurial and no new tax expenditures. But I mean, do you think on the savings side, do you think some expenditures should be diverted to open source projects? And I mean, like the Media Lab that did the Red Balloon project. I mean, do you see a more concentrated government strategy, kind of like vis-a-vis IBM, to be an investor in open source platforms to save?
I want to be very clear on this. We are very bullish on open platforms for collaboration. That may or may not involve proprietary systems in various levels along the way. So, for example, in health IT, so long as the role of government is to set the very simple standards for how you transmit personal health data from A to B, and that we have clarity around how that is safe and secure with full respect to patient privacy, I don't care if it's an open source platform that moves the data or a proprietary platform. We just want to get that standard for interoperability right. So we're going to have examples where in some cases there are open source tools and agencies that have to make judgments about that will use them. But in many cases it may be proprietary, and we're totally comfortable with all of those. But the key is getting the right role for government in the most narrowest sense and execute with great precision. And I'm thankful that the agencies, under the leadership of my colleague, the CIO, are working very hard on managing the $76 billion of IT spend. That is the responsibility of our Chief Information Officer. And those judgments about how we save money for the taxpayers is in his domain. Yes, ma'am.
Thank you. Karen Hirsch, thank you for the very, very enlightening and hopeful presentation.
Thank you.
Regarding what seems to me to be the most urgent issue facing all of us, which is the hemorrhaging of oil in the Gulf.
Yes.
Based on a New York Times article I read earlier in the week, at that point there seemed to be chaos in terms of what is potentially within our control, which is the stemming of oil reaching the shores and the marshlands of Louisiana. I'm wondering how, and this is a question to everybody in the room, how these brilliant resources and commitments can be put into practice immediately to convene a process of collaborative problem solving around shore cleanup that involves representatives of all the stakeholder groups in a non-hierarchical, brilliantly facilitated process so that people, instead of competing with each other, are working together. This is urgent.
Let me make a simple observation. A, I appreciate your comment, and I will share it with Carol Browner, who's leading our effort. Number two, I will 100% provide for you the context. One, we already have been making the data available on imagery and EPA findings that is today publicly available, and we'll do a better job of making it easier for you to find that information, but today we've made that information available. Two, we are very keen on hearing from the American people on ideas. We had a process whereby we've collected over 7,000 ideas from the American people on scientific approaches to the challenges, in addition to deploying our best and brightest minds from Nobel Prize-winning Secretary Chu to my colleague, the science advisor, Dr. Holdren, and others who have been working with scientists around the country on bringing the best and the brightest ideas into the Gulf. Your point about how we formalize that into an ecosystem akin to what we're seeing here, I will take that feedback. Thank you.
Thank you.
Yes, sir.
Hi, my name is Seamus Kraft. I work in the U.S. House of Representatives. Thank you for coming. We look to you guys for a lot of inspiration and ideas and stuff on the Hill. One of the problems we have on the Hill, though, is the rule framework for all new media communications, digital communications. There's a big disconnect and a gap there. And I know you guys have had some issues with, using things like Google Buzz, and how do you make sure all this stuff, sort of fits under the Presidential Records Act rule, and how can you ensure the American people that you guys are following through on that?
Well, that's why we're not as bullish and have not been as all in on some of those tools, because, for example, in my office at the White House, I'm not allowed to access social media. So half the times cool things are sent to me. I'm like, oh, what's this? Oh, blocked. Great, thanks. So we have very strict rules about what we are allowed to do and how we're allowed to communicate. But we are working closely on easing up on those rules. You may have seen we issued guidance as part of the Open Government Directive on how we would address cookies policy and related activities. These are all part of a policy framework that are making their way through the system for agencies. We did some work on how agencies can ask questions using these crowdsourcing platforms and how that aligns with what we were required to do under the Paperwork Reduction Act. So we've got legal minds working on these issues. It's a priority. Some would like us to have solved them a year ago. These take time, but I'm confident we're going to make a big difference. By the way, this is why universities are awesome, because universities have great resources where they can expand, they can be innovative. For example, Crisis Commons just released the Oil Reporter iPhone app. It's connected to a server at San Diego State University where anybody can take a picture or a video clip of environmental challenges, share that with the American people, host that at the San Diego State site. They've mashed it up with data from the National Oceanic and Atmospheric Administration, NOAA. So that mashup is taking place not on a government server where we may have had challenges, but actually in a university context. So we're getting there. We're using all resources that are possible, but we have to be very careful not to screw it up. So we have lawyers and others making sure that we do this by the book and ensure we don't do anything that violates the spirit and the rules in which we operate.
We have time for one more question. We're going to.
Hi, Aneesh. It's Mike Smith here.
Good to see you again.
IQ. Good to see you. About 6 months ago, I came to your office. We were sharing some data and some numbers about the swine flu epidemic. And we had NIH number 1, number 2 for microsites, WebMD was 2 or 3, and then CDC, and they were all ranked beautifully. And you said, well, I don't really care about rankings or about the information and who has it first. I just want it promulgated everywhere.
Yes.
So moms and families can find out about swine flu. As you continue these public-private partnerships, I'm wondering what the commercial side or the private side can do to do a better job of linking, scraping data, sharing government information, and forget about this whole search report card we seem to have and flatten things. And I think you've answered a lot of it already, but just make it more democratic. The sites you have on healthy kids in particular, what can we do to just promulgate it everywhere?
No, look, if there's anything that I'm bullish on right now, it's I'm hungry for requests on information that you think has value in whatever context, so that we can feed that to the agencies. I have many requests for information. Anyone can request, if you go to data.gov, you'll see a little tab that says request a data set. Anybody can ask. People contact me all the time, and I run those leads to the ground. We absolutely want to make sure that information is easy to get. And sometimes they say, hey, I have to screen scrape, and then you do a change to your web content management system, and then I have to redo my screen scraping. That's lame.
Yeah.
Let us make the information available in machine-readable format. Tell us where it's valuable. That stuff is low marginal cost for us, and if it can extend value, then so be it. I will run that play every day from Sunday. Share those ideas with me. Share them online. We'll run that to the ground. Thank you, Andrew, for the time.
Thank you, Aneesh.
Sorry I've gone over.
No, no.